Is your county capable of treating you?
Today in medicine, I want to ask you a question, and I want your honest answer. Do you think your county, county yako, where you are now, do you think it's handling health properly? Because with medical healthcare workers have been fighting and saying, yeah, human resource should be nationalized, healthcare should be nationalized to the central government. But there's still the argument that it has brought healthcare closer to the people, and the governors insist that they're doing a good job, and the counties want to keep it. Now, I think healthcare workers should give up, and the citizens should take over. Like wananchi waamue. What do you think? Do you think your governor, do you think your county government is able to handle the health? Because I know, I saw the other day Morara was in Laikipia County, and he was saying how the county is not handling health vizuri, how they're not taking shi for sha, and yet there's a government hospital and there's a government project. How come a county referral hospital is not accepting that insurance? You have to ask yourselves questions. Yeah, they only accept cash, and it got me asking myself one question: how come? How come? How is education in Kenya free? Education that you can live without to 100 and something. My grandmother lived to 90 what, and she wasn't educated. How come that is free, but health is not free? How do we get here? How do we have so many superhighways? Yani, see how many lanes of tarmac road, but healthcare is not accessible. How do we get here? How are you able to drive from Mombasa to Kisumu or to Busia? But in case you're sick along the road, my friend, you're done for. In case you get an accident along the road and you're a Jondo and nobody knows you, you are done for. How did we get here? And I like Miskela. Miskela alikuwa anasema Kenyans liked roads, they were given roads. Kenyans during Moi's eras wanted education, they were given education. They were given schools. Education was made free. But now Kenyans have never wanted health. It is high time Kenyans prioritize your health and you demanded for health. Remember when we did the podcast with Dr. Makada about Murang'a County, and Murang'a County is doing amazing. Like his description was top notch, and even you guys are saying, "Hi, Wango stories are Jabba." But that should be the norm. That should be the bare minimum. I mean, an ICU, a CT scan, a neurosurgeon should be bare minimum. Daktari, a quick one. Adios.